here over here with one of your favorites, and that is Dr. Lutz. How you doing, sir?
I'm doing great today.
Yeah, we are just in here having a good time talking about Caddy and his greatness and how we're just honored to be in the same room as he. But since we are talking about the chiropractic aspect of it, my question to you, we touched on a three-pronged approach. Can you just give us a little bit more into that?
Yeah, three-pronged approach, that's a kind of a little catchphrase, but it's really what we do here. One part is chiropractic, and that gets the body back in the right position, the right alignment. It gets you to feel better, it gets you to move better. Massage therapy works the muscles. Chiropractors work the bones and the joints. The massage therapists are also trying to help with the pain, get those muscles to recover better, feel better so you can do more. And the third prong is the physical therapy, and that's really what strengthens you up. That gets everything back together so you don't have to keep coming in to see the chiropractor. That's one of the biggest fallacies that's out there is, you got to go see the chiropractor. You got to keep going. When we get you into PT and we can build those muscles back up, we get better stability, and then you don't have to come as long. And what we found is our treatment times have been able to go down over time, because we get people to do the right rehab and they get stronger, and then they're able to go on their own.
All right, and just for the listening audience, PT is physical therapy, right?
Correct, that's physical therapy, yes.
All right, and Robin was just in here and she was talking about something about if you're starting to get a head cold or something, there's certain things that the chiropractor can do.
It's not really injury related. This is just more general health related. The nervous system, which we are working with as chiropractors, we're trying to get the nervous system to work better, work at a higher functioning rate. And when viruses hit and colds and flu and you're not feeling the best, you get the symptoms. You get the chest aches, you get the body aches, the joint aches, the head cold, the stuffy nose. I got it here if you can't tell with my voice. But as we adjust people, we're really working on getting the nervous system to work better. And part of the nervous system is your immune function. So as we adjust you, and there's some other techniques that we use to with sinus pressure and pressure point and that type of stuff, we can kind of open up and get the body to drain a little bit better, get the blood flowing a little bit better, get the sinuses to flow a little bit better, and hopefully clean some of that stuff out a little bit quicker for you.
Caddy was talking about new patients and how you go about treating new patients versus patients that you have had come in more frequently. Can you talk about that?
Yeah, with any new patient, the first thing we do is we sit down and talk with them. We have to find out about them, find out what brings them to us, what the problem is. But we also, we kind of delve into just their overall health. We want to get a holistic picture of the patient. Because we're not just treating the symptoms, we're treating the whole body to increase the whole function. So when we have a new patient, we're just going to take a little bit longer as we go through that history, what they've had before, have they had injuries before, how's their overall health. With patients that return, if it's been a long time, we might have to do that. But most of the time, we've got that background information. So we don't necessarily have to go through all the background information, and we can kind of address the problem that they're coming in to see us that day. So it doesn't quite take as long, but we're always going to take the amount of time that it needs to really get a full picture of the patient each and every visit.
So throughout the different visits, does a person's body have to heal a little bit, or is it the more approach of coming in and adjustment works better?
That's a really good question. There is a little bit of a recovery period from treatment, and that's why we set up treatment plans at certain rates, and it kind of depends on how the patient comes in. And some patients, when they're really fresh and they're hurting and what we call very acute, we're going to have to see them very frequently. Other patients, as they progress through care, we will see a gradual reduction on how often they come in. One, because some of the things that we're doing in physical therapy and the rehab are a little more taxing on them, a little tougher, because their bodies can tolerate it. And they need a little bit of a recovery period afterwards. So really that's based off of where somebody is in care and how they present and what they're presenting for. So yeah, it's not the same for everybody. It's not very regimented. It's very individually found.
All right, and the question I've been asking everyone is, with a day such as today, what would you say to drivers?
One, turn your lights on, because it's cloudy and rainy out there. Make sure the lights are on. You know, what's nice about cars nowadays is most of them have the automatic lights, but make sure your lights are on. 2, when you're following somebody, give them more space, because on wet roads like this, if they brake suddenly and you have to brake suddenly, your tires and brakes aren't going to grip as well on the road. It's going to take longer for you to stop. You got to increase your following distance, and just be aware. Especially making turns and corners. Be aware. Be a defensive driver out there.
All right. Well, thank you very much, Dr. Lutz.
Sounds good. Thank you very much, too.
All right. We are going back to you, Mr. Walter Q. Red Banks Jr. in the studio. We are here,